Welcome to my virtual presentation. I am Dr. Kibet from the Center for Open Distance and E-Learning, Machakos University. Today, we are going to look at how to recognize a child that is being abused. How shall we know that a child is being abused? Are we able to recognize a child who has been abused? The first step in helping abused children is learning to recognize the signs of child abuse and neglect. The presence of a single sign does not prove child abuse is occurring in a family, but a closer look at the situation may be warranted when these signs appear repeatedly or in combination. Specific signs and symptoms depend on the type of abuse and can vary. Keep in mind that warning signs are just that, warning signs. The presence of warning signs doesn't necessarily mean that a child is being abused. Now, let's look at different signs that we can use to identify a child that is getting abused. One is the physical abuse signs and symptoms. These are unexplained injuries such as bruises, fractures, or burns, injuries that doesn't match the given explanation. On the side of the sexual abuse signs and symptoms, how shall we know that the child is sexually being abused? The sign includes sexual behavior or knowledge that is inappropriate for the child's age, pregnancy or a sexually transmitted infection, blood in the child's underwear, statements that he or she was sexually abused, inappropriate sexual contact with other children. Now let's turn to the emotional abuse signs and symptoms. These are delayed or inappropriate emotional development, loss of self-confidence or self-esteem, social withdrawal or loss of interest or enthusiasm, depression, avoidance of certain situations such as refusing to go to school or ride a bus, disparately seeks affection, a decrease in school performance or loss of interest in school, loss of previously acquired developmental skills. Now let's turn to the neglect signs and symptoms. The following should be observed: poor growth or weight gain or being overweight, poor hygiene, lack of clothing or supplies to meet physical needs, taking food or money without permission, hiding food for later times, poor record of school attendance, lack of appropriate attention for medical, dental, or psychological problems, or lack of necessary follow-up care. And lastly, parental behavior. We can also recognize a child who is being abused from the parental behavior. Sometimes a parent's behavior sends a red flag about the child abuse. Warning signs include a parent who, 1, shows little concern for the child, appears unable to recognize physical or emotional distress in the child, blames the child for the problems, consistently belittles or berates the child, and describes the child with negative terms such as worthless or evil, expects the child to provide him or her with attention and care, and seems jealous of other family members getting attention from the child, uses harsh physical discipline, demands an inappropriate level of physical or academic performance, severely limits the child's contact with others, and offers conflicting or unconvincing explanations for a child's injuries or no explanation at all. That marks the end of my physical presentation, where we've been looking at how to recognize that a child is being abused. Thank you.